Okay, so my topic was how to be a decision maker. So how did I come up with this topic? I tried to choose something that was fairly common in the medical field that nurses and other healthcare providers are faced with each day, whether they realize it or not. So I came up with decision making and being a decision maker when working with patients. So whether that's making a decision about a certain medication, questioning the doctor's orders, partaking in a routine procedure, to discussing options like for end-of-life care. So this topic varies widely and often goes unnoticed on a day-to-day basis, which is why I wanted to further research how individuals come to a senses when choosing important decisions that determine one's future. So I conducted an interview and researched various articles that helped narrow my focus on decision making while hoping to learn what it's personally like to deal with difficult decisions as a nurse. So, little introduction, decision making has consequences to making the wrong decision or to making no decision at all. It's important to weigh out all of the options available before choosing what's best for somebody else. So this presentation is going to explore the challenge of dealing with difficult decisions for healthcare providers and what it takes to be a decision maker within the healthcare field. So these are my 3 research articles. And I found a relationship within all 3 of these articles, which are very, very similar. And they all deal with end-of-life care, which I thought was a perfect transition off of my topic of decision making, because it takes a lot of decisions and critical thinking to determine one's outcome on life. I then related these articles based on my interview with Nicole Durham, who is a cardiovascular intensive care unit nurse at the Med Center, who currently partakes in the role as a charge nurse as well. The cardiovascular unit deals with a lot of unpredictable outcomes of individuals' lives, leading to my topic of being a decision maker during difficult and critical times such as the end-of-life process. So here's my article number 1, which is supporting staff to cope with death and dying. And these are just a few quotes that I picked from the article that I thought covered some of the key points. So death and the issues surrounding death are important, if challenging, area of consideration, and consequently many people do not feel confident discussing it or dealing with the practical and emotional issues it evokes. It is a voluntary process of discussion and review to help an individual who has capacity to anticipate how their condition may affect them in the future. So the cardiovascular unit is prone to unexpected and unpredictable death occurrences that require a lot of decisions to be made regarding the health and the outcome of those patients, which is why all of my articles correlate with end-of-life care, because it was the most fitting with my topic and Nicole's personal experience on the unit as well. It is a difficult decision that arises on a daily basis, and once again, it comes down to the final decision of the nurse and the MD to choose what is right for all of their patients. Nicole works overnights, so she mentions how end-of-life isn't really something she's often faced with because she doesn't have those doctors or other important healthcare providers at the bedside of her patients for any assistance or for any other recommendations. So she more so advocates to change code status of a patient or to involve the families with a family meeting if it is needed. And she explains how her actions are based on her knowledge in the background of those patients, since she doesn't have those doctors at hand. So the second article is Nurses Cope with Patient Deaths, and this is more the planning process and what decisions do the patients want versus what decision does the nurse suggest. So decisions based on acceptability and consequences that may follow, self-care and coping, like what the nurses do to assist themselves when making critical life decisions for patients, and then that advocacy role, that public support and recommendations. So like I said, Nicole's position, she advocates the most when discussing the change of a patient's health status and to think more critically rather than just relying on that phone call to the rapid response team or to the MD. And then the third article is how do you prepare to discuss advanced care planning? This is more of the preparation process and the quality of life of those patients and their thoughts and their preferences. And then here's another quote also that says, patients trust nurses to hear their concerns and help them work through the many conflicting emotions and decisions in advanced illness. So the cardiovascular unit is where majority of its patients remained in the hospital for quite some time. So this has allowed Nicole to become extremely close with her patients, which in turn made it fairly easier for her to talk about end of life if needed and make important decisions with her patients because she's already established that trusting relationship with each of them. So it kind of makes it a little bit easier for her to bring upon these decisions. So the article's strengths, all their research was thoroughly explained and well conducted with the use of examples to explain the main purpose of each article. They were all published by nursing journals, which are really vital resources. They highlighted the key points for better understanding, and they mentioned various programs and community resources within the research articles. There weren't very many weaknesses, just that they weren't up to date. They were about over a year old, and the authors had different perspectives and different opinions on end of life and how to decide for their patients. And then the interview strengths, Nicole was very open and interested in all the questions I asked her. She explained in great detail her role as a charge nurse and what kinds of experiences she faced when it came to making decisions, like changing the code status, including the family, asking the patient what they wanted. And she explained the types of interactions and bonds she created with her patients and how she went about collaborating and providing cares for each of them. And then the weaknesses, she only talked about her personal experiences rather than the cardiovascular unit as one and like as a team. She didn't explain specific situations when decision-making for a patient was vital. She more so just picked out the key points, like acting as an advocator. And there was really no accurate description of what would happen when the MD or the RRT was called. And these are my references, and that is it.